Hello, my name is Caleb Puebla and I am a nursing student at Trinity College of Nursing and Health Sciences. My presentation will be overviewing Dorothea Orem and her self-care deficit theory. Dorothea Orem is best known for creating her self-care deficit theory, which was published in 1971 and is a grand theory that can be used across all areas of nursing. To provide some context, Dorothea Orem was born on June 15, 1914 in Baltimore, Maryland. Dorothea lived to the ripe age of 93 years old when she died on June 22, 2007. In the early 1930s, she obtained her nursing diploma from Providence Hospital School of Nursing in Washington, D.C. She continued on to receive her Bachelor's of Science in Nursing in 1939 and pursued her master's degree in nursing, which she received in 1945, both of which she obtained from Catholic University in Washington. She had an esteemed educational background and was given honorary doctorates of science, humane letters, and honoris causa. Orem's nursing career started in 1934 when she began practicing at Providence Hospital in Washington, D.C. She worked at Providence for several years before leaving to Massachusetts to work at St. John's Hospital. In 1939, she made a career change and traveled to Detroit, where she worked as a biological science teacher at Providence Hospital School of Nursing. In 1942, she traveled back to Providence Hospital in Washington, D.C., and worked in practice as a nurse for another year. In 1945, she became the director of Providence Hospital School of Nursing. She stuck with teaching and administration until the 1970s. In 1971, she published her famous nursing theory called the self-care deficit theory of nursing. She went on to author many papers and speak at workshop conferences around the world in the late 70s and 80s. The idea behind Orem's self-care theory is that the client is unable to meet their self-care needs due to an insult that impairs optimal functioning. Nursing interventions are required to help restore function or help cope with the initial insult. These interventions are used to maintain self-care needs while the client is unable, and they are aimed to promote independence. For example, let's say a man just had his leg amputated after getting into a car crash. The man will never be able to walk the same again. However, with nursing intervention, we can aid with rehabilitation by educating the client how to use assistive devices to walk, such as crutches. The idea is that the client will never grow that leg back, but we can use interventions and hope that the client will regain optimal function with the new injury. The self-care deficit theory can be broken down into three theories: theory of self-care, self-care deficit theory, and the nursing systems theory. Theory of self-care is defined by activities people partake in to maintain their life, health, and well-being. All individuals should be able to meet their self-care activities so long as factors like state of health, environment, healthcare services, economic resources, community, and biological factors are not impeding their ability to maintain self-care. There are three categories that make up self-care, the first being universal self-care. This entails the maintenance of basic needs like adequate food and water intake, a balance of good rest, work, and social life. The universal self-care requisites aim to maintain human structure and functional integrity. The developmental self-care requisites deal with the person's ability to adapt to change. Life events like getting a new job, moving to a new city, and joining a new social group are changes that require new self-care needs. The ability to adapt to these changes by maintaining self-care needs is important. The health deviation self-care requisites refer to conditions that affect health status and require more self-care needs than usual. For example, a newly diagnosed diabetic will have to learn how to properly manage their blood sugar, find ways to make it to doctor's appointments, and adjusting to lifestyle changes in diet and exercise. Self-care deficit theory is based on a client being unable to meet their essential self-care needs because of limitations or barriers of function that are in place preventing them from doing so. Nursing interventions are then required to help maintain their basic self-care needs. One method to help is acting for or doing for others. For example, a client is unable to brush their teeth because they are too weak to move, so you brush their teeth for them. Another method is guiding others in the right direction. Referring someone who just had a knee replacement to physical therapy for rehabilitation is an example of this. Supporting another person involves just being there. Listening to someone who just experienced a terrible loss is a great way to support someone. Providing an environment that engages a client in wanting to make a change, allowing their participation and family participation in recovery sets up a more comfortable environment. Educating others is always a great way to promote independence. Teaching a diabetic how to manage their diabetes will help prevent further complications. The nursing systems theory is about providing for others who cannot provide for themselves. This theory can be broken down into three system categories. The first is the wholly compensatory nursing system. This system is employed when the client you are working with is completely dependent. For example, a patient who is intubated and sedated is completely dependent on the caregiver. They will need to be turned every 2 hours, have oral care done, and be cleaned up for every bowel movement and fed because they are unable to participate in their own self-care. The partial compensatory system is when the client is able to perform some self-care activities but needs assistance with the rest. For example, a post-operative client who just had a knee replacement will need assistance ambulating to the bathroom, but they are able to go by themselves. The last system is the supportive educative system. This system is designed for people who can meet their own needs but lack the ability to perform these tasks. For example, a client with type 1 diabetes is capable of maintaining their blood sugar but needs assistance in learning how to properly dose themselves with insulin. The nurse's role in applying Orem's theory is to meet the self-care deficits of clients. We want to promote the participation of the client so they are able to meet their self-care needs independently. We can accomplish this task by guiding and directing the patient. If the patient is still unable to meet their self-care requirements, the nurse will assist the client and teach them new ways to meet their self-care needs. Orem's theory can be applied in any field of nursing. One specific example that her theory can be applied to is for a patient who just suffered from an ischemic stroke. An insult, the stroke, resulted in deficits in mental status, speech, swallowing, and right-sided function and sensation. The patient is unable to maintain their self-care needs due to the stroke. Therefore, nursing intervention is required until the patient is able to regain functional independence. Some interventions that we could implement would be to maintain safety by using assistive devices like walkers to ambulate, using a bedside commode so that they can stand and pivot with their good side to use the restroom, writing referrals to physical therapy, occupational therapy, and speech to promote independence, assisting them with feeding with easy-to-swallow foods to prevent aspiration, and educating them on their increased risk of having another stroke, anticoagulant therapy that they will need to follow up with, and an additional follow-up appointments. These interventions are implemented to help the patient maintain their basic needs until they are able to independently care for themselves or learn to function at their new maximum capability. In conclusion, we talked about Orem's self-care theory that was published in 1971. This theory is a grand theory that can be implemented across all areas of nursing. This theory outlines the needs of every human to maintain self-care. If an insult is too great for someone to maintain self-care, nursing interventions are needed. These are my two discussion questions. What does self-care mean to you, and how do you care for yourself? And how would you implement Orem's self-care deficit theory in an individual with a mental illness like depression? Thank you.